And welcome back to Sunday House Call now for Should I Worry, our weekly segment where we talk about a lot of stuff that worries us. One viewer writes, I've been hearing a lot about hospital-acquired infections. What can patients do to find a safe hospital? Dr. Siegel, go to the hospital. It's supposed to make you feel better, not worse.
Yeah, absolutely. And you have to make sure you do your best if you're a patient to make sure that you have an eye on this. And we've talked about the fact that the Centers for Disease Control in the past has pointed out 2 million cases a year of resistant infections, that most of those come from hospitals. So what do we do about that? Why is that happening? It's happening because the hospitals aren't properly cleaned. It's happening because people aren't washing their hands. It's happening because they're not wearing gloves the way they should. It's also happening, Eric, because hospitals take care of a lot of complex cases. And so I don't want to point a finger at our most famous hospitals because they may have the sickest patients. The sickest patients are prone to the most infections. So if you look at Consumer Reports and you look at Medicare and Medicaid services or you look at the Centers for Disease Control, they're all going to have listings that you can look up on which hospitals are the worst. And Medicare is actually going to penalize hospitals if they start having more and more infections. But the key is hygiene.
So, but if you, one second, David, if you see this list in your hospitals on it, it's in your neighborhood, it's where you're going to go, what do you do?
Well, I wouldn't not go to a hospital because it's on the list. I think I would ask my doctor that was admitting to the hospital, what's this about? You know, what does this cover? Does it cover catheters? Urinary catheters are one issue. Does it cover surgical wounds? What are they talking about here? Is it resistant bacteria? You can get those answers. But I could give those answers for the hospitals that I deal with.
Dr. Samadi, I had a relative in a hospital recently, and I asked for professional strength wipes. I had to put on gloves. I cleaned down that whole hospital, wiped down the bed, railings, and everything.
You did that?
Yeah. Come on now.
You know, it's actually it's a good idea. People don't do this because if the patient before you in that room had some sort of a C. difficile, or if they have MRSA.
What's C. diff?
These are like bugs.
What's C. diff?
C. diff is a bug. It's an infection you get from the hospital, right? So if the patient has left and now you're coming in and you're touching the surface, and a lot of those surfaces may not have been cleaned up, she may be right. She's using these bleach towels and clean up your surface. You do the same thing in the planes with that tray. So there are these bugs everywhere.
Well, shouldn't this also, could this be affected everywhere? Like if you go to a hotel, use a computer or go, anything you touch, public bathrooms,
what does
this
that
sort of
tell
thing?
you? That you have to be your own doctor. And the hospitals also have a major role to make sure that they're cleaned up. CMS, Center of Medicare Services, is going to punish them or penalize them by 1% of the reimbursement, so they would fix it. It's all being reported. It's all online, and people know which
but should you carry your own, like, wipes?
You should, and you should hand wash. The doctors need to wash their hands, but these are from catheters, they're from ventilators, they're from devices that we put in central lines, surgical wounds. So as doctors, we also have to really pay attention to this. It's one of the reasons why I always believe not to mix the patients. A surgical patient that may have E. coli or C. diff should not get mixed with urology patients. That's why we have a whole dedicated floor to my patients and urology patients, because the disease from orthopedics could be different. The bug that from pneumonia could be different. So you don't want to have the old concept of putting all the patients on the same floor and mix all these bugs. It's bad for everyone.
You know, the hand wipes are great, and they are all around the hospitals, and you got to look for them. But there's nothing better than washing your hands. Still nothing better than washing your hands. And some of these bugs go from bed to bed, like C. difficile is a huge problem.
All right, so wash your hands and use that hand sanitizer that they got on the wall. You know when you push that and you get
Not just the doctors, the patients and the family members.
We go.
Family members too.
And at the airport and everywhere else.
Oh, I'm a fool for all that stuff. Oh, okay, I'm sorry.